Welcome to Hello Baltimore County. I'm your host, Ellen Kobler. Baltimore County has a new fire chief with a lot of positive ideas and initiatives. We're very pleased to welcome to the Hello Baltimore County studios Fire Chief Kyrle Preis. Thank you so much for joining us.
Thank you for having me.
Well, first of all, why don't you share with us a little bit about your background?
Okay, I have a little over 27 years on the job in the fire department. I came to work in 1990 for Baltimore County as an EMT and rose through the ranks. This is the 9th position or rank that I've had in the department, and it's been a fun ride.
All right, and you started out on the volunteer side?
I did. I started out at 16 years old as a volunteer at the Kingsville Volunteer Fire Company. I still live in the area. I was born and raised there, and that gave me the training and the education and the initiative, if you will, to make this a career.
And you kind of got the bug, right?
I did, yeah.
So let's talk a little bit about the modern day fire service. You fight fires, but I think more people see you responding to medical emergencies, is that right?
Yeah, that's true. We're what we like to call an all hazards business. So, and the majority of what we do today, and it really hasn't changed, it's been this way for years, but the majority of what we do are calls for emergency medical services. In 2016, we ran approximately 135,000 calls for service, and over 100,000 of those were for EMS-related incidents. The number of fires, working fires especially, has decreased over the years due to a number of reasons: building construction, fire codes, sprinklers, smoke detectors, public education and awareness. Yet the EMS continues to increase. The population increases. Healthcare in general, many people do not have primary care providers. They use 911 as kind of their primary care provider in some instances, and go to the emergency rooms for different things. And that's what we're here to do, to help out.
Okay, so you mentioned that the fire suppression calls are decreasing, and is that true kind of just locally or nationally? Because I got to say, on the news you still see a lot of house fires, and it's very, very frightening. You do.
It's but it is a national trend that those fires do decrease. But when they happen, they are. They're sometimes, or what we see on the news, it's something catastrophic, or there's a loss of life associated with that. But in general, and it is nationally, that the number of fires have decreased. The number of fire-related deaths decrease. It's almost at a zero, the number of fire deaths associated with the sprinklered occupancy. So it's very important that several years ago we put additional legislation in place to sprinkler single-family homes in Baltimore County, and that's going to make a difference. It's going to save lives.
The new construction. All right, talk a little bit about your staff. Training is very important, especially you mentioned the all hazards response. You respond to accidents on the beltway and on the roads. You respond to medical emergencies, like you said. If there's a hazmat, if there's a hazardous release, you respond to that. How do you make sure that your staff is trained to know what to do in an instant, given whatever faces them?
Well, that's good questions. It's difficult. It's a lot of training that's involved to keep up the speed and be ready to handle whatever incident comes in. We do have specifically designated units and personnel for hazardous materials or advanced tactical rescue or more technical type rescues.
Like a trench rescue.
Exactly.
Yeah.
We have a team that's deployed out of a particular station for that. For hazardous materials, we have one station that's they receive additional training in that discipline, and every one of our employees has an awareness to handle any kind of incident that comes in, but then we bring in our technical experts, but it's a lot of training. And those technical stations, where they need more training, that doesn't take them away from their everyday jobs. They still have to respond on calls. They're not just they're not one-dimensional.
They don't just sit around waiting for their particular...
No, and they just don't train. They do a lot of training, but they still respond on the calls within their catchment area or their district, and there's still other things that they need to do. They perform fire inspections, they do maintenance on hydrants, and then the daily activities of station life they still have to perform.
So what do you do to support the both the medics and the firefighters in terms of the physical and emotional demands of the job?
This is I'm glad you mentioned that. This is it's a very physical job. And, emotionally, it can take its toll. Our men and women see things that most people don't see. So it's of primary concern to me, our physical well-being and our mental well-being. So we do look out for our personnel. As far as physically, both career and volunteer fire and EMS personnel are required to have yearly physicals to make sure that they're physically capable of doing the job. And it's important that all of us co-workers look out for each other to make sure that we're able to handle things emotionally. At the top of my priorities as chief of this department is truly the safety, health, and wellness of all of our members. And that means on the fire ground, on an EMS scene, on a rescue, and off duty as well. It's a lot of stressors that we have a lot of stressors here, a lot of things that affect us, and we have to make sure that when we get off duty and we're spending time with our friends and families that we're able to cope and we have the support that we need for that.
And yet it is a job that a lot of people are interested in. Are you in a recruitment mode? Are you looking for new firefighters and medics?
We are. I like to say we're always recruiting. We're processing an EMS class of both EMTs and paramedics at the same time as for firefighters, and it's an exciting time. And I'm looking to continue our mission to increase the diversity within our department. When it comes to our ratio of male to female members of our department, which we are national leaders in the numbers of women that we have in our department.
I know County Executive Kamenetz has spoken on the show about that as a priority, both females, minority
Absolutely.
individuals in the community.
Yeah, it's a county executive's priority, and I'm committed to that as well. So we aggressively recruit and target people that can do this job, but it's a physically demanding job. And it can be more difficult for some people, and it's a difficult job physically for women. So
I might have trouble dragging you out of a burning building, right?
Yeah, but we can work with you on that.
Okay.
Yeah, we can do
Very
that.
good. You mentioned briefly education and outreach to the public.
Yes.
What do you do to let people know how to protect their families from fire, and what sorts of messages do you communicate, and how do you get the word out?
Well, in today's day and age, we use social media. We use our Facebook account and Instagram to push messages out. That's a great mechanism to use, but we also do target community groups, and we go out. So a station will have community groups that they'll go out and meet with, and we try to stay engaged. If there are fairs and events that are going on, we go out and try to get the message out about fire safety education and EMS education. And we are working on a program to educate everyone a little bit more on EMS and what we do, and maybe some other avenues for some people to use versus calling 911.
For example, contacting the Baltimore County Health Department if they need some
Right.
longer term
Again, going back to if
assistance,
people that, how important it is to have a primary care physician versus, calling 911, every time we have some sort of injury or something happens, or if we get, we get to the point where we get knocked down because we have the flu. But if we would have gotten our flu shot a few months before, maybe this wouldn't have even happened.
Right,
So.
sure. Or some of those chronic conditions where if they're properly maintained, they hopefully don't turn into a medical emergency.
Exactly.
All right. Well, congratulations on your promotion.
Thank you.
And thank you very much for taking some time to be with us today.
Thanks for having me.
Sure. And thank you for watching Hello Baltimore County. As you can see, we're all in good hands under the leadership of Chief Preis and his excellent team. Thanks for watching, and we encourage you to connect with Baltimore County government on our website and on all of our social media platforms.